County, local health officials confirmed 6 new cases of COVID-19, bringing the total to 36. They also confirmed 1 more coronavirus-related death, bringing that total to 2. And as Fort Wayne's NBC reporter Corinne Rose explains, while our coronavirus numbers certainly are not anywhere near what Indianapolis is seeing, they're worrisome all the same.
Compared to other places, Allen County's numbers may not seem too alarming, but they are climbing. More than half of Allen County's patients are 50 years and older, especially people 70 to 79 years old. 2/3 of patients have had to be hospitalized, with 16% of them needing to be intubated and 13% of them developing acute respiratory distress syndrome. That means their bodies are fighting so hard to get rid of the coronavirus, they are destroying the lungs in the process. If patients do survive that after weeks in the hospital, it is not an easy recovery.
They've been on very heavy sedation because being on a ventilator isn't very comfortable for these patients. So in a lot of cases, they may be paralyzed. They're on medicine for their blood pressure. They're on heavy sedation. And in the process of that, their muscles become weak. So there's going to be a lot of physical rehabilitation as well as the rehabilitation of the lungs and the heart as they try to get better.
In the hospital, each of those patients require round-the-clock care from nurses and doctors who are putting their own lives at risk to treat them. And that's already taking a toll.
When you see what's coming and what you've seen that's happened in Italy and New York, and you know that may be our unit next, it's a lot of anxiety knowing that you may have a unit full of these patients and they aren't getting better quickly. They're going to be in there very sick for a week or 2 weeks. If they survive.
How much is coronavirus disrupting your work life, your home life? Do you think about it all the time?
I work here in the inpatient unit, and we have seen an increase in people who are being admitted due to, I would say, COVID-related concerns. So it's absolutely not the medical aspect of the virus, but it's the constant read. It's I'm always worried about this. I'm not sleeping because I'm thinking about it, or the people are paranoid that they're going to get it.
The experts advise you to stick to a sleep routine, get exercise, and limit your time on social media. They say remind yourself and your kids that while you can't know what the future holds, you can control how often you wash your hands, how far away you stay from other people, and know that medical professionals are doing all they can to treat people. They also say there is absolutely no shame in reaching out for some mental health help. Corinne Rose, Fort Wayne's NBC.